Hi, my name is Taban. I'm an oculoplastic surgeon in Beverly Hills. I'm an assistant clinical professor at UCLA. So in this video, I'll be talking to you about what causes droopy upper lids and its management. First, there are three separate things, but they can occur together, that can cause the upper eyelids to feel and look saggy and heavy. One is if the actual eyelid itself comes down. The technical term for that is ptosis. That's because the muscle that is responsible for lifting the eyelid 20,000 times over time every day, this muscle can stretch and the eyelid drops. Or the muscle could be weaker to begin with congenitally, genetically. The treatment is the same. Tightening the muscle to raise the eyelid. Let me show you some examples here. So you can see this patient, the eyelid, upper eyelid is lower. Makes the eye look smaller and sleepy. By tightening the muscle, the eyelid is raised and the eye becomes more open. So look at this person, before, after. Another person, before, after ptosis surgery. The second thing that can make the upper eyelids look and feel saggy is the skin on the outside stretches over time. What do we do for that? We take extra skin off. This is called upper blepharoplasty. So in upper blepharoplasty, what we're doing is we're just taking skin off. It's important not to take any fat off in general, so you avoid the hollow look. So it's important to preserve the fat. So what does skin removal do? As you can see in this photo here, the skin that's resting on the lashes is taken away. But notice the actual eyelid does not get raised. It stays in position. The lashes stay in position. So the eye opening stays the same because the skin has nothing to do with the eyelid position. Again, the eyelid position has to do with the muscle that's deeper. Now, if the patient has both problems, the muscle issue and the skin issue, well, they can have both procedure. This person had both issues. The muscle was tightened to raise the upper lid. At the same time, extra skin was taken off. The third thing that can make the upper eyelids look and feel saggy is a droopy eyebrow. I get a lot of patients who come to me who says, "Doctor, I have a droopy eyelid." When I look at them, it's actually the eyebrow has come down. So in those cases, actually eyebrow lift is the proper management. Or as I said, it could be a combination of these factors. It could be the ptosis, it could be skin issue, or it could be the brow, or altogether different degrees. All procedures can be done at the same time with the same recovery. The recovery is bruising, swelling for about a week, 10 days. The procedures are either done under local anesthesia in the office or under conscious sedation in the outpatient surgery center. I do not recommend doing them under general anesthesia because general anesthesia is more risky, has a longer downtime, and it's been shown to cause memory loss. So if you don't need general anesthesia, you shouldn't have general anesthesia. The recovery is practically painless. Now, it is hard to open the eyes because of swelling, bruising, but the vision is okay. Patient can function normally. They can walk around, they can go outside, watch TV, whatever they want. Probably not a good idea to drive for a few days, but they can function normally otherwise. There are stitches that are placed, and they're usually taken out about a week later. There are also absorbable stitches that can be placed that they can melt away on their own. Very importantly is how the procedures are done and the result. The result needs to be natural. Nobody should know you had any of these procedures. You just need to look more refreshed, more awake, less sleepy, just better for your age. Not to look different. You don't want to change your eye shape. You just want to look better for your age. So in order to achieve that, you need to go to a surgeon that uses minimal invasive techniques and they're not aggressive. And the goal of looking natural is considered. An oculoplastic surgeon, they are eye plastic specialists. they're ophthalmology trained, and then, for example, me, I've done a 2-year fellowship in doing eye plastic surgery only. So I only deal with this much of the face doing plastic surgery. So a proper consultation with an oculoplastic specialist is important to determine what is causing the droopy eyelid, or what factors are involved and what treatments are going to be needed.